We'll have this lecture and we'll be talking in depth on the concept of sputum MCS. Now, this sputum MCS is a thing that almost every um, medical student must have seen somewhere, right? So they always write sputum MCS, urine MCS, and the rest of that, right? And some people always write this as one of the investigations that you could do for disease condition, and they don't really know what this MCS even stands for, right? So in this lecture, we are trying to like an overview, trying to look at every concept to see how true it is, or how will I put it, right? So you're just basically trying to verify details, right? So that I can actually know what a sputum MCS is, right? So first of all, this sputum MCS actually stands for what? The MCS stands for microscopy, culture, and sensitivity. So in the full one now is what? Sputum microscopy, culture, and sensitivity. So because the word is long, they usually just shorten it to MCS. Okay? So it's actually a diagnostic test used to examine sputum samples for the presence of what? Microorganism. If you are collecting a sputum from a patient, you're trying to what? Establish the presence of what? Microorganism. So from establishing the presence of microorganisms, you are still going further to now know the specific microorganism that is present there. Okay? So now let's define the terminologies. If you are doing microscopy, let's pick one. If it is microscopy, they are trying to examine under a microscope to identify either what? Bacteria, fungi, parasites. If you are doing culture, what does culture in microbiology means? You are trying to grow the microorganism. So you are suspected that the microorganism is there. But sometimes you want to grow the microorganism to study one or two things. Alright? You can grow them either to isolate them or test some drugs on them to see which type of antibiotics will work on them best, right? Therefore, sensitivity or susceptibility is you testing the isolated microorganisms what susceptibility to certain antibiotics, right? So that it will now guide the type of treatment you are giving. You can also now monitor for drug resistance, right? Sputum MCS is used to diagnose. So you can diagnose and monitor any respiratory infections such as pneumonia, bronchitis, or tuberculosis. Use it to diagnose, then manage in the sense that it will now guide you on which type of what medicine to use. Okay, it can help you to identify the causative pathogen, select appropriate antibiotic therapy, and also monitor treatment effectiveness. Because as you are doing the MCS, you are now monitoring how the microorganism is going down. All right. So I think that's it for what? Sputum MCS or sputum microscopy. Good luck.